the SCFP Awards of Excellence. The Awards of Excellence recognize CFPC members who in the past 12 to 24 months have made an outstanding contribution in a specific area, such as patient care, community service, hospital or healthcare institutions, college activities, national or chapter, teaching and/or research. Dr. Stan Olsinski.
Hi, I'm Stan Olsinski. I'm a family physician in Prince Albert. So I'm a family physician. I've been in Prince Albert for 36 years now. I provide comprehensive care. So back then we used to work emergency departments. Since then now we have emergency room physicians. So we don't do that anymore. I still do deliveries. I still do nursing home cares. Occasionally I still even do a home visit for some of my patients who are shut in. And of course I work in the office. So that has been my career over the past 36 years. When I was in medicine, we certainly do many rotations. Back then there were still internships as well as family medicine residency. I wanted to do family medicine. I enjoy the connection with families, as well as I like a wide variety of areas in medicine, not just one speciality, so I chose family medicine, and I've been loving it ever since. I was very surprised when I heard I was getting this award. It's a nice feather in your cap as you're getting towards the tail end of your career. So I'm very happy to get this recognition. I could probably work forever. I hope I can actually retire someday. I'll see what that's like, because I really love what I do every day. I love the connection with my patients. I love working on policies with some of the committees I'm with, and it gives me lots of energy.
Dr. Carla Holinati has been nominated for contributions to the medical community in Saskatoon and throughout Saskatchewan through her leadership and advocacy for family physicians and patients.
My name is Carla Holinati and I practice at the West Winds Primary Health Centre in Saskatoon. I do a little bit of everything, sort of full spectrum family medicine care from start of life to end of life. Being a family doctor is the best job that there is. You get to be part of people's lives and you get to be part of their families. You get to be with them sometimes at the best parts of their lives, and you get to help them through the worst parts, and you're just sort of the constant that's there through it all. So I think it's just a big honor and a privilege to get to do what we do. I chose family medicine because I like the variety. I like that my days are always different. I like that I never know what I'm gonna see when I come in the door that day. I like that it's not repetitive. If I did a job where I just saw the same problems and the same types of people all day, every day, I don't think it would be interesting enough to keep me occupied. Receiving this award was a huge honor. It was something that I had no idea was coming and was not expecting at all. And I think knowing that your colleagues thought enough of what you were doing to nominate you for an award, and that a group of your peers then looked at it and thought that it was, you know, something good enough that they wanted to recognize you for, it was really spectacular. It made me feel really, really humbled and honored, and it was great.
The Michael Krochak Award for contributions to family medicine. This award is intended to recognize an individual, group, or organization that has made a significant contribution to family medicine in Saskatchewan through clinical research, educational, or administrative activities. Dr. Alana Danelkowicz was nominated for her outstanding dedication and contributions to teaching and her patients. Alana provided care to her patients and through relationship and continuity helped navigate her patients through life's journey.
My name is Alana Diane Danelkowicz, and I do not practice now. I have an appointment as an associate professor of family medicine in the College of Medicine, and I retired on December 31st of 2019. I am a professor of family medicine, and I had basically 4 roles when I worked. I was a clinician, a teacher, a researcher, and an administrator. And my last appointment was department head for family medicine. I wanted to be a doctor, which is probably the first thing and the only thing. I grew up in Meadow Lake, and the only type of doctor I knew was a family doctor, and that was Dr. Ken Haight, and I used to follow him around. I watched him, do some simple suturing, talk to patients, look after patients with diabetes and cancer, and later he became one of my colleagues, and that's how I got interested in family medicine. I never really worked for a ward. I just did the work, and I guess it's just kind of pleasant to receive this award.